next speaker. The co-founder of European Cannabinoid Therapy Association, Dr. Gregor Zorn.
Thank you very much. So we can skip this. We're talking about cannabis, medical cannabis. So what is cannabis? Cannabis is one species, Cannabis sativa linnae. We have several subspecies or varieties of cannabis, but it's not important for us. We have heard a lot about strains of cannabis, different names. The strain terminology is actually not used for botany. It's not used for plants. It's used for viruses and bacteria. So despite the fact that it's used a lot, it doesn't mean that it's correct, and it doesn't mean that it should be used. We can use different names, such as chemovars, which is a better classification, meaning chemical variety, or cultivar, a cultivated variety of cannabis. Now, hemp is another artificial term. It's still cannabis, but it's defined by the limit of THC, which is different in different countries, in different areas. We can see that in the European Union, it's 0.2%, up to 0.2%. In the United States, it's 0.3%. And then in different countries, like in Italy, it's up to 0.6%. And in Switzerland, it's up to 1%. For therapy reasons, the most important thing is the ratios and the percentages of the active constituents. Now, another classification of cannabis is by chemotype. So we have type 1, type 1, which is a high THC. Then we have type 2, which is an equal ratio of THC and CBD. And we have type 3, which is high CBD, low THC. Now, just by looking at the flower, the inflorescence of cannabis, or smelling it or tasting it, we cannot see or find out what's inside it. The only way to find out what's inside it is to test it. And medical cannabis should be tested in the lab so that we know what are the constituents inside it. So what are these constituents? We already heard that the cannabis plant produces cannabinoids in the form of acids. Cannabis does not produce one molecule of delta-9 THC or CBD enzymatically, but it does produce THCA and CBDA and CBCA. So we heard also that CBGA is the precursor of all the cannabinoids. It's actually not. It's the precursor of the pentyl cannabinoids, the ones that have a 5-carbon side chain. Then we have CBGVA, which is a varin, and these are the propyl cannabinoids. These are the ones that have 3-carbon atom, a side chain. So we already heard that if we want to get the neutral cannabinoids from the acidic ones, so if we want to get delta-9 THC from THCA, something has to happen. Usually it's via heat, so we burn the product, let's say, or heat it up, and then we get this transformation, which is called decarboxylation from THCA to delta-9 THC. Now, there's a third category of cannabinoids, phytocannabinoids, plant cannabinoids, which are the so-called aged cannabinoids. And these, of course, differ from the neutral cannabinoids in the sense that we can, well, find out at least two things. First of all, these elements, so CBN and delta-8 THC, which can be oxidized from delta-9 THC, tell us something about the cannabis that we are using. And the higher the levels of these cannabinoids that are present in this cannabis or this cannabinoid product, it means that the more it has aged or it has been stored incorrectly. So the levels of delta-9 THC go down, and the levels of CBN cannabinol and delta-8 THC, which is an isomer of delta-9 THC, go up. Meaning, of course, that also the properties of this cannabis or cannabis product are different. because CBN has different properties than delta-9, and also delta-8 THC has different properties than delta-9. It is more stable, it is less potent, and so on. So this is important. It also tells us how to store cannabis. So we should store it away from heat, away from light, and away from oxygen. Now, the other category of cannabinoids, we mentioned the plant cannabinoids or phytocannabinoids, are the synthetic cannabinoids. These, of course, are synthesized in the lab, and one example is dronabinol, so synthetic THC. As we already heard, it's not really that popular because it has, in comparison, especially to whole plant extracts, it is less effective, it has more side effects, more quantities are needed for the desired effect, and it's very unpredictable. It is not a pleasant, let's say, molecule. It's not a pleasant experience. That's why it doesn't have a black market, as we heard before. Of course, the other components of cannabis, the other terpenoids, the other cannabinoids are missing, so there is no synergism. There's no synergistic effect. And it has a narrow therapeutic window, and also it is really not the same as delta-9 THC because of the nature of how it is made, of chirality and stereoisomerism. It is not the same molecule, at least as a whole. Oh, so what did I do? Somebody help me. This one? Yeah, there we go. Fantastic. So I'm going back. Okay, this is fun. Synthetic cannabinoids are also used as medical products, and this is the case of nabilone, which, as we can see, is a synthetic analog of THC. It has a slightly different configuration than THC. It has a 7-carbon atom side chain, and there are also other synthetic cannabinoids which are mainly used in laboratory studies, and these are potent selective CB1 agonists, and they have been also used in the so-called synthetic cannabis. So what is synthetic cannabis? Synthetic cannabis has nothing to do with cannabis. It is actually any plant material that has been sprayed or laced with one and more synthetic cannabinoids, which are very strong and potent selective CB1 agonists. And they have very serious side effects, like liver injury, coma, and even death. And the thing is, these are designer drugs, so they are changed all the time, so it's very difficult to identify them, to test for them. That's why they're used in prisons and other situations where there is testing, and they can test for THC, but for these synthetic cannabinoids, actually, they don't test them. And they're also problematic because minors can get access to them through the internet. Now, this is one study that showed how these cannabinoids can be, synthetic cannabinoids or synthetic cannabis can be really dangerous. So this was a case of a study published in 2017 where people were behaving like zombies because they took this synthetic cannabis. And as we can see, this AMB Fubinaca is 85 times more potent than delta-9 THC. And we can also see from this picture that the progression of these synthetic cannabinoids has been to make them more and more potent. And this is still progressing, and it's a problem. And we can also see that the structure of these synthetic cannabinoids is totally different from the structure of delta-9 THC. Not only that, but in synthetic cannabis, there have also been other things that shouldn't be present in cannabis, other toxicants, which have, of course, caused a lot of grief and even death, and not only in cannabis, but also in CBD oils. They have found, synthetic cannabinoids, such as this one, 4-CCB, which has nothing to do with CBD, as you can see from the structure, and this is also something that should not happen, and sadly, these are things that are happening right now on the market, so we should be very careful. And another reason why cannabis and cannabinoid products should be tested. So for medical cannabis products, of course, the source is always, usually, cannabis, so cannabis inflorescens. These are buds or flowering female tops that are unfertilized because there's a higher quantity of cannabinoids in them. You can make teas, you can make extracts, you can make ointments, but for focused use, use of cannabis, medicinal use, we usually use two methods for having a systemic absorption. One method is via inhalation, using vaporization, and the other method is oral, usually using tinctures for systemic absorption. Then, of course, we already heard we have ointments and creams for external use, and we also have suppositories. Now, there is a wide range of products that are made from cannabis. Well, not in this country, but in many other countries, sadly. And all of these products are actually made from plant cannabinoids. So we have heard about Sativex and Epidiolex. Both products are actually made from cannabis extracts, Epidiolex being a CBD extract and Sativex being a quasi one-to-one THC to CBD extract. And of course, we have different kinds of flowers. Here we have a type 1, so a high THC flower. Then we have a type 2, an equal CBD to THC flower, and we have a type 3, which is a high CBD flower. Now, smoking, sadly, is not a therapeutic way of inhaling cannabis, because if you burn anything, being that cannabis or chamomile or even tobacco, there are certain toxic molecules that are produced in this combustion, and this is, of course, it produces also phlegm, it produces cough, and all kinds of side effects which are not something that should be used in medicinal use of cannabis. Also, vaping via these e-juices and these devices is also not recommended. So the thing that is usually recommended is dry herb vaporizing. So what is a vaporizer? A vaporizer is a device that actually heats up the plant material without burning it. So it heats up the heating chamber or the air or both, and this makes it so that these active constituents, so the cannabinoids and the terpenes, they evaporate without burning the material. So this, of course, has a lot of advantages. We have different devices, so these are desktop devices, these are portable devices, this is even an inhaler, it's not a vaporizer really, and we'll see more about this Psyche device in the future. And these are all also medical devices. It's very easy to dose with them. You can titrate very easily, take one inhalation, wait for a few minutes and see the effects, then take another inhalation and so on. The effects are immediate because it goes directly into the lungs and into the blood, so you can feel the effects very fast. There's no toxic byproducts as produced when we burn or smoke cannabis, and there's a greater efficacy because, of course, you don't burn the plant material, so you can use it more than once, of course, depending on the quantity that you actually need of these cannabinoids. And unlike smoking a joint that you can smell from 20 meters, this usually doesn't produce any, let's say, smell, and they can also be used inside, so you can use a vaporizer in a hotel and the alarm won't go off, which of course is very important for patients. Now the other method that I mentioned was oral, of course. We heard a lot about oral use of cannabinoid products, and usually these extracts are diluted in some sort of vegetable oil. This can be olive oil, this can be MCT oil, or even hemp oil. And this makes it so that we can dose really precisely by dropper or even by drops. So 1, 2, 3 drops, you know exactly the quantity that we're using. And if we, of course, use this dropper and take these drops sublingually, we can also achieve this submucosal absorption of cannabinoids directly into the blood system, which makes it so that the effects are felt faster, so there's a faster onset of action. There's a greater efficacy because actually the oils enhance the bioavailability of the extract, and there's a faster onset of action, as I mentioned, and precise dosing. Of course, not all of these, let's say, preparations are absorbed via the mucosa. A lot of it is swallowed, but if we achieve something, it's always good. Now, if you compare inhalation to oral ingestion of cannabinoids, we can see that there's certain differences. First of all, the onset of action with inhalation is very fast. In a matter of minutes, you can feel the effects, sometimes even in a matter of seconds. And with oral, as we heard before, there's a delay in the onset of action. So when we take cannabinoid preparations and before we feel the effect, there can be a delay of half an hour and a half, or even more. So this is very important, as mentioned before, for cannabis-naive patients who take one dose, they wait for 25 minutes, nothing happens, they take another dose, and then when it starts working, they have a double dose, which can be too much, and they can have these serious side effects. Another difference, of course, is the maximum effect, which with inhalation is, let's say, about 15 minutes, so the maximum level in the blood, whereas with oral, it's about 2 to 3 hours. And also, the duration of the effects is different. So with inhalation, usually the effects last for 2 to 4 hours, whereas with oral, they can last for 6 to 8 hours, let's say. These two methods, of course, are not mutually exclusive. It depends what you're trying to achieve, what symptom you're trying to treat. So if somebody has pain now, or they have an onset of, let's say, migraine now, and they want to stop it right now, it's a good idea to use a vaporizer to have the effects immediately. But the effects will last for a shorter period of time. So if you want the effects to last for a longer period of time, we usually use oral products, but we have to keep in mind that before the effects start working, there's going to be a delay. So we heard about suppositories. They can be used, of course, internally. And the goal with cannabinoids is always to get them as close as possible to the place of the problem, the origin of the problem. They're extremely effective for local problems, such as hemorrhoids, such as menstrual cramps. They work really well. But for systemic absorption, they're not really good. They have very poor systemic absorption. And as mentioned before, people are taking incredibly high doses of THC via suppositories, and they don't feel high. Why they don't feel high? There's no absorption. There's no bioavailability. They can be enhanced bioavailability, but they have to be made in a separate way. And this doesn't work usually with plant cannabinoids. Now, topicals, creams, salves, ointments, they're of course used via the skin or the mucosa. They're very effective in various skin diseases. The effect is localized. Again, cannabinoids don't really like to penetrate the skin, so there is a little systemic absorption if they're not enhanced. And they're very, very fast acting. Actually, you can feel the effects on pain or on itchiness very fast. And you need small quantities, actually, of these cannabinoids to have an effect in these preparations. Now, in regards to dosing, using cannabis is a very subjective experience. It depends, and when I say cannabis, I mean THC in the sense of the tolerance, which is the expression of CB1 receptors. And of course, we heard about the endocannabinoid tone, which is the expression of all the elements of the endocannabinoid system, so the endocannabinoids, the enzymes, and the receptors. And there are other factors to take into account, so how you feel, what you ate, the genetic factors, how physically active you are, and so on. Oftentimes, when asked what is the optimal dose, I would say that the optimal dose is the lowest dose of cannabinoids that has the desired effects on a specific symptom of the disease without these side effects. We must always keep in mind that we are targeting the endocannabinoid system, which is a homeostatic regulatory mechanism, so it's a balance mechanism, and if we take too much, we can actually put this system again out of balance. Now, the dosing recommendations, usually in the literature we see that 2.5 milligrams, this is for THC, is a threshold dose where you can feel the effects. 5 milligrams is a moderate dose, 10 milligrams can be a high dose, and 50 milligrams, as heard by Dr. Russo, can have serious adverse events. Now, this is the literature, but in our experience, when dosing, start as low as possible. This is something that we heard before. Even less than 1 milligram of THC. With CBD, it's not such a problem, but with THC, it's a problem. And there are several reasons why. The first one, it's that a certain percentage of people are extremely sensitive to THC. They feel even the smallest amounts of THC, even in conjunction with CBD. And so it's a good idea to start as low as possible so we can target these people and target their therapeutic window. Now, the other thing that is also interesting with patients is that sometimes the first dose of THC, actually the patient won't feel it. Even if it's a higher dose. They need, it's like kind of a restart of the endocannabinoid system, so the first dose doesn't have an effect, and the second dose they can feel it. So starting at a lower dose actually triggers this reset of the endocannabinoid system, and that's why, again, it's a good idea to start with as low dose as possible. Another good thing is to always have CBD with THC. as we heard before, CBD enhances some of the therapeutic properties of THC while reducing some of the unwanted side effects that THC can have. So we've seen a lot of times in many medical conditions that a one-to-one ratio of THC and CBD is a good starting dose for a lot of medical conditions. Of course, there are exceptions. And one thing also that is interesting and patients have good, let's say, experience with is microdosing or mini-dosing, which means taking smaller quantities of cannabinoids several times a day. And this can be very effective in medical conditions such as, let's say, insomnia or other stuff. Now, with the elderly and the children, usually it's a good idea to start with a higher CBD ratio to THC ratio. Of course, if CBD works alone, fine. But in the experience and in general, THC is absolutely needed in the majority of these chronic severe diseases, because THC is actually the one that modulates directly the endocannabinoid system via activation of the CB1 and the CB2 receptor, so it has a very important role in medical cannabis therapy. Now, how long should I try cannabis before I get the effects? It really depends. Some people see the effects really fast. They take the first time cannabis, let's say for sleep, they sleep well, and the next time they feel great. In other patients, it takes time. You have to find the right ratio of cannabinoids, you have to find the right dosage of cannabinoids, and you have to find the right method that's suitable for this specific patient. So what I would suggest is don't give up, just try it, try different preparations, and usually you will get at least one benefit, at least in one symptom, and if it doesn't work, it doesn't work, so no harm done usually. So talking about side effects with CBD, CBD usually has very little side effects or no side effects. You actually don't feel it unless at very high quantities. And studies are mainly done with pure CBD. With CBD-rich extracts, we see even less side effects. At higher doses, several studies have shown that up to 600 milligrams per day, this was again pure CBD, less than 10% of the patients usually had these side effects, so drowsiness, indigestion, fatigue, decreased appetite, and these were minor side effects, and usually they were taken care of just by reducing the dose of CBD. Now with THC, we can see a whole bunch of different side effects that are usually mentioned in the literature, but in practice, a few often come up as the ones that the patients are mostly affected by. Now, tachycardia has already been mentioned before, so elevated heartbeat, and another thing that often happens is vertigo, so orthostatic hypotension, which is when you stand up very quickly and you get dizzy in your head because there's no oxygen in your blood, and this can be mitigated very well just by breathing, so getting deep breaths and getting a lot of oxygen in your brain. Dry mouth is another, or cotton mouth as it's called in English, is another thing that can happen as a side effect. Of course, there's sedation, dizziness, feeling drowsy, and so on. Increased appetite, as mentioned before, this can be a bad thing or it can be a good thing. It depends. For recreational users, this increased appetite, well, it can be a bad thing when you come at 2 a.m. in the morning and you want to raid the fridge. Especially things that are very fat and very sugary, so hedonic eating, this is something that happens a lot. But for patients such as patients who have HIV/AIDS or patients who are using chemotherapy and they don't have an appetite and they can even have vomiting and nausea, this can be very helpful and extremely helpful in giving them back their appetite. And we all know how important it is for patients to eat their food, to be better, let's say, suited for treating the disease. The same goes with memory loss, short-term memory loss. You come to the kitchen, what was I looking for? So this is short-term memory loss that happens a lot of the time with THC. But forgetting is extremely important. It is a mechanism, especially in traumatic events, that is extremely important in reducing the memory. So the consolidation of the memory is extremely important, and THC can help. And if this doesn't happen, usually it leads to PTSD, another let's say, medical conditions where we have this reoccurrence of the same memory going over and over and over in your brain and even dreaming about it and so on. So again, forgetting is a good or a bad thing. It depends on the situation. And there's also difficulty in concentration and other side effects that can be mentioned, but these are the main ones. So when talking about THC toxicity, how safe, how toxic is it? We already heard there has been no documented case of death from THC cannabis ever in the world. So this is something that is extremely important, and it tells us how this molecule is extremely benign. And as we heard before, this is mainly due to the fact that in the brainstem, this region of the brain, especially in the Pre-Botzinger complex, where we have these centers for breathing and heartbeat, there's hardly any CB1 receptors. So THC cannot actually physically bind there. But there are opioid receptors, and we heard before, this can lead, of course, to death from higher doses of opioids because there is a cessation of breathing. There have also been many studies done with Sativex and Marinol, which both have THC, showing these very safety, let's say, reasons of THC. With CBD, as mentioned before, it's very well tolerated in humans, even at high doses and even at chronic use. There is, of course, this interaction of CBD because it actually inhibits these enzymes that metabolize more than 50% of these conventional prescription drugs. And this, of course, is problematic when taking higher doses of CBD and taking these medications together. But as mentioned by the speaker before me, this is not something that occurs at lower doses and is mainly a problem at taking higher doses. And it's a good idea if you're taking CBD to take it at least 2 hours before taking other medications, just so you don't get these kinds of interactions, again, at higher levels. There, of course, needs to be further studies to determine, let's say, the effects of CBD on hormones and larger clinical trials with, of course, more patients, with a longer duration of this clinical trial, so we really see the effects of CBD long term. Now, of course, cannabis should, and when I say cannabis, this is usually THC cannabis, and this is the problem. When saying cannabis, what are we talking about? It's like saying fruit. Are we talking about the banana? Are we talking about the apple? What are we talking about? So with THC cannabis, there are some precautions that should be used. But what's interesting that in many of these diseases that cannabis should be used with caution, actually cannabis helps a lot. As we heard from schizophrenia, what type of cannabis? We're talking about CBD here, and psychosis, and also for liver disease, and for asthma. In my country, in the old days, they used to actually sell cigarettes from THC for asthma. So it really depends what we're talking about, and we have to be really careful in determining what type of cannabis we're talking about. Now, another important aspect is feeding your endocannabinoid system. So it doesn't matter if you take in cannabinoids and your endocannabinoid system doesn't work. So we have to have a working endocannabinoid system, and of course this is due also to the endocannabinoid tone. And one of the most important aspects is nutrition. This is something that each and every one of you can have a direct effect on, and nutrition is the #1 most important thing in the majority of diseases. And especially having these high nutrition organic foods is very important, so forget about the calories, it's all about the nutrients. I'll mention omega-3 fats. So this is something that is usually missing in our Western diets, and it's extremely important, first of all, because they're the precursors of the omega-3 endocannabinoids, which have been studied very little, but do have a very important effect, especially anti-inflammatory effect. And also, omega-3s are important for the working, let's say, of the endocannabinoid system, for the working of the CB1 receptors. So it's important to add them to the diet. Now, prebiotics and probiotics are also extremely important because, well, we are understanding now more and more the importance of the bacteria, the flora that we have in our body. The gut-brain axis is extremely important. The immune system is present in the gut in the majority. The neurotransmitters are made in the gut, so this connection between our gut flora and the correct flora and the brain and many diseases is extremely important, and this can be, of course, changed and modulated via the right foods. Vitamins and minerals, of course, are also important and should be added mostly to the diet because, sadly, most of the food that is produced nowadays is lacking, is very deficient in these essential elements such as vitamins and minerals. Another thing that was mentioned is physical exercise. Yes, physical exercise does upregulate your endocannabinoid system, but there's a catch. You have to like what you're doing. So it doesn't matter what you're doing. You can go cycling, you can go playing basketball or playing tennis, but you have to like it. You have to enjoy it. If you're doing something that you hate, it can cause stress, and this can actually downregulate the endocannabinoid system. So it doesn't matter what you do, just enjoy it. Another thing, of course, is the mind. The mind is an extremely important mechanism. We've heard about the placebo effect, which is nothing more than believing that something is helping you, and it's actually helping you. And meditation and believing in cannabis, that it will help you, and even spirituality are all important factors in having a better, let's say, efficacy of cannabinoid preparations. This is the last slide. So we all need cannabis, and I think medical cannabis needs you. So in my opinion, medical cannabis should be free and be available to the patients who need it. If it's your medicine, it is your medicine, and you should be able to have it. They should be available products in pharmacies, and insurers should cover it. The prohibition has been shown to be totally a wrong decision, and it should be ended. People who want to grow cannabis at home, they should be allowed to grow it at home. Of course, the majority of the patients will not grow it at home. The majority of patients do not grow tomatoes at home or brew their beer at home. So, this is for the people who actually want to grow it at home. And of course, as mentioned before, medical cannabis education for professionals with events such as this one is extremely important. And please do support your local advocacy groups such as the OPCM, which did an amazing job with this conference, by the way. Thank you. There you go. Beautiful. And last thing, spread the word. Share the word, share the knowledge via social media. Talk to your parents, talk to everybody who's willing to listen about cannabis, because cannabis can change the world, and we can make the world a better place. Thank you very much.
Thank you. Questions and answers. Yeah.
Thank
you
you.
stay here. Yeah, we won't
We
leave.
have three questions,
Three questions.
I believe. Why don't we start with the first one?
Diogo Carvalheira. Can you raise? Oh, yeah.
All the way in the back.
You
Great.
see all the
Thank
way in the
you.
back?
No,
Can you? Yeah, again. Okay. So the question is, in a RCT study in dogs treated for epilepsy with CBD, the alt values showed some increase in the first 2 weeks. Is there any evidence of changes in the hepatic values in humans?
I actually don't know. I can tell you a little bit about epilepsy in dogs. We had actually a case of a dog that had epilepsy, and we didn't use CBD, but THC, and actually help. Because in the majority of studies, actually, THC is not proconvulsant. It doesn't cause epileptic seizures, but it actually helps. Of course, the dosage is extremely important. But again, this tells us that it's very complicated, and it's not a one-size-fits-all. And this is very difficult to understand for a lot of, let's say, medical professionals that are used to one drug for one target for one specific condition. With cannabis, it's very, very diverse. Every person is different. Every person has a different genetics. Every person has a different way of dealing with these things. And so we're trying to standardize medicine for us, which we are unstandardized. So the thing is always to try. You can try being cannabis or cannabinoids, THC and CBD is so safe. You can really start with small doses and try and see the effects. And of course, if you have the ability to measure the metabolites, to measure all these things that can be important, then we can really get the information that we need to have, let's say, just guidelines to see at which doses, which ratios would be a good idea to start in different medical conditions. And yes, all vertebrates have the endocannabinoid system. So fish have it, reptiles have it, birds have it, all mammals have it, and even some lower animals have it, such as sea squirts. So this system is extremely important, and it has been preserved for millions of years in all these species, which means that it's extremely important for the survival of these animals. So modulating this system can be a very, very important aspect of really treating a wide variety of diseases. And cannabinoids, in this case, are one of the most useful, let's say, therapeutics for treatment of a wide variety of different diseases. There are very little other compounds, especially natural compounds, that can treat such a wide variety of different diseases.
Thank you.
Thank you. This is from Andre Segurado. Thank you, Andre. This is about synthetic cannabinoids, doctor. Do you consider that the NPS phenomenon, the new psychoactive substances where some synthetic cannabinoids are included, are a result of chemical trials of the pharmaceutical industry into looking for new alternatives for THC as a medicinal cannabis? Or do you think that's the reason why pharmaceutical companies are now more focused on the raw plant?
Well, usually at the beginning, these synthetic cannabinoids, the potent CB1 selective agonists, were used mainly for testing. And they have been used, people have seen how potent they are and have tried to exploit the system. So it's usually not the pharmaceutical companies and let's say the researchers that are doing this, but it's the illegal laboratories that are doing all these machinations and just changing a little bit and having these cannabinoids, synthetic cannabinoids, being more potent. So I think it's more of a black market thing than a big pharma thing, and but it's a big problem. Of course, it's a big problem because unlike plant cannabinoids, these are dangerous. These kill people. And the problem is also that people associate when they hear about synthetic cannabis, oh, this is cannabis. It's not cannabis. And they say, yeah, people have died because of this and this cannabis, and that's what remains in the mind. And so cannabis gets a bad name. That's why we have to be very careful when talking about synthetic cannabis and know really the difference, that this has nothing to do with cannabis, that cannabis is a safe plant and it's a natural plant and has been around for, let's say, 28 million years. So, you know, it's another level. And please stay away from synthetic cannabinoids.
Thank you.
Thank you.
So one more question. Jude Murray. There. Right here, yeah. So, okay, yeah, I listened to myself. Okay, do you consider that NPS phenomenon, new psychoactive substances, were some synthetic cannabinoids?
This was the last question.
Oh, I'm sorry. Yeah, I got confused with my own voice. Okay, I go again. In your professional opinion, how effective could administration of high doses of THC from full-spectrum medical cannabis be as an aspect of an early intervention program in preventing the onset of PTSD in a patient who has endured an acute traumatic experience?
Well, this is an excellent question. We don't know that. We don't know the doses. This has never been tried. What I remember, and it's very interesting, was from a colleague who said, I had the privilege of serving in the Vietnam War. And there were two groups of guys. There were a group of guys that went out and had a few beers, so they drank alcohol. And there was another group of guys that I was part of that went out and smoked cannabis. And what was interesting, when we came back, none of the group that smoked cannabis actually had PTSD, but a lot of the group that actually had alcohol did have PTSD. So with dosing, it's another thing that's very difficult to understand. The therapeutic window for cannabinoids is extremely wide. You can get from the same indication, it doesn't matter how big the man is or how small the man is. The therapeutic dose can be, let's say, 3 milligrams. It can be 3,000 milligrams for the same condition. So this is such a wide therapeutic dose that we don't find in most medicines, and it's extremely difficult for medical professionals to understand. But this is the reality. If 3 milligrams works for you or 3,000 milligrams works for you for the same effect, and the 3,000 milligrams of THC actually doesn't make you high, and it's your medicine, then it's your medicine. And once again, this is all about trying and getting these doses, which doses would be the real ones to prevent this kind of, let's say, PTSD effects and so on. This is something that has to be studied, and I really don't know the answer, but I think it's better than to try it than to have these consequences, because if you don't try it, you will have PTSD. If you try it, maybe you won't have PTSD. But yes, we do need more studies about the effects and the quantities that would be therapeutically useful. for, let's say, a majority of the population.
Thank you, Doctor. One more question from Ms. Sofia Duarte. Sofia Duarte. Thank you, Sofia. Doctor, do you know if the ketogenic diet potentiates the effect of CBD in children with refractory epilepsy?
No.
That was easy.
But incredible things can be done with diet. I don't know how this, to answer your question, I don't know, but I do know, I did study nutrition before getting into cannabis, so I know the effects of these types of diets that can have, especially on children, where the major problem, of course, is sugar. Sugar is everywhere. It is addictive, as mentioned before. It's more addictive than cocaine and so on. And also how these foods are produced. So all this non-fat stupidity that's going on, well, all the foods that don't have fat, they actually have sugar inside. So sugar is a major problem, and it's causing a lot of problems. Plus, of course, the pesticides used to produce these foods are also present in these products. So we have a lot of pesticides that are causing all kinds of damages, again, to the gut microbiome, so the gut bacteria. We have 10 times more bacteria on and in our body than we have the cells in our body. So we are actually not one organism, we're an ecosystem. So if you're ever lonely, you're never alone. You have billions of bacteria with you, okay? But these bacteria are incredibly important, especially, as I mentioned before, this gut-brain axis. How the gut affects the brain and vice versa, and how changes via nutrition, via antibiotics, via these pesticides can affect the correct, let's say, ratios of these bacteria in the gut. And when these ratios are not correct, actually bad bacteria come into play, and we have also fungi such as candida, and this can cause a lot of troubles and a lot of medical conditions.
Thank you.
Thank you very much, Doctor.